Every year, Sutter Health releases The Power of Purple as employees system-wide team up with the March of Dimes to give babies a healthy start in life.
2013 marks the 75th anniversary of the March of Dimes.
Tracy Vann coordinates the campaign, and for her, the 15-year partnership went from job duty to personal passion in one gut-wrenching moment.
I was literally driving to the office to start work on the campaign when my telephone rang. And it was my mom on the phone, and she was crying. And she said that my sister, who was 7 months pregnant at the time, was in labor at the hospital, and they didn't think that they could stop the labor.
By the time she got to the hospital, Tracy had a tiny niece named Olivia.
It was at that moment that I truly understood that prematurity and these types of crises happen to anybody at any time.
When I first came to Sutter 10 years ago, these are the first 2 Beanie Babies that I bought on behalf of the March of Dimes campaign.
Donna Sanders' own life is a reminder every day that a baby born too early is at risk of serious medical conditions.
In 1966, my mom went into premature labor. When I was born, I was 3 pounds. I was born 14 weeks premature. Within 10 minutes of my birth, I was given last rites.
Donna was born with cerebral palsy, one of the many neurological conditions closely linked to prematurity.
If there's a way that you can prevent somebody from having to go through some of the things that I know my parents went through, then I think that that's the best thing to do. And if I can do that by contributing to the March of Dimes campaign, then I'm helping somebody through maybe some of the roughest times of their life.
Nearly 4,000 babies a year are born prematurely across Sutter Health, and every dollar we raise for the March of Dimes promotes better outcomes, life-saving research, and development of key protocols. CPMC NICU nurse Erin Regina sees daily why this work is imperative, yet her moment of clarity was personal.
My aha moment was kind of, my pregnancy. Everything was perfect right out the gates until about 22 weeks. When I went in for a routine appointment, they found that my cervix had shortened down to almost nothing.
Erin was immediately admitted to the hospital.
I was terrified. I was terrified because I knew how terrible it would be to deliver at that point. The different things that the perinatologist did with me to try and preserve my pregnancy, all of those things take research, and that's what March of Dimes does. They research what can we do to keep them from delivering preterm.
Defying every odd, Grady and Reese were born at 36 weeks. Today, they're 17 months old, happy and healthy.
I think about where we started and where we ended up. The bed rest, it was hard, but it was for them, and knowing that doing it got them to where they were, I'd do it again in a heartbeat.
Sutter Health employees have raised over $6 million for the March of Dimes, bringing hope and knowledge to give every baby a healthy start in life.
It is something that can happen to anybody. One night, you could be that mom getting rushed into the OR. So to know that it can be you, it can be the person working next to you, is why it's so important that we all continue to contribute to the March of Dimes.
Become involved. Don't take this for granted. Don't take your children's health for granted. Become involved and contribute.
When I spend time with Olivia now, who's a very active, almost 7-year-old, I realize how blessed I am to be part of an organization with literally thousands of colleagues across the system that may not have an Olivia in their life, but they have the compassion and the caring within themselves to open up their hearts and their wallets to support this incredible partnership and to support the life-saving mission of the March of Dimes.